Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Loyd Bittle. He's CEO and founder at Innovar Healthcare. Welcome, Loyd.
Good to meet you, John.
Yeah, it's good to be here to have a conversation with you. But tell us a little bit about yourself and Innovar Healthcare.
Sure. So we've worked in the integration and interoperability space for a number of years. Innovar will come up on our fifth year next month, and prior to Innovar, we worked with a number of the state HIEs formed around the country, and our focus in areas is in interop and integration.
Interesting. Well, there's so much happening with interoperability in healthcare, and some might say not enough, but that's another conversation. But how does Innovar kind of differentiate itself from all the other interoperability solutions that are currently in the market?
So I think our key area is in our focus on integration and interop. We're also tightly woven into the last mile connection. When I say last mile, I'm talking about that final layer between either the EHR vendors or other systems you're trying to connect to and the sending or receiving system. So that is the heavy lift. And you have a number of other vendors that are in this space or recent entries in the space that do not focus on that last mile integration. And that is really the heavy lift in integration and interoperability is that field level detail that many others are challenged with. And so we've chosen to focus in that area. And I think that's where we've gotten really good at it. We've learned using tools and methodologies, using our library of interfaces and connections. We've really gotten efficient and good in that area. And so that's what Innovar is doing.
Interesting. Can you give some examples in healthcare of what where you've done this last mile integration?
Sure.
And really, the problems that they were having?
Sure. So we've had, early on, out of the gate, we were working with inpatient acute care.
Okay.
And we did a lot of work in that space for a number of years. My background is in inpatient acute care. And so it was something that I was very familiar with.
Yeah, still an expertise.
Yeah. But then, as COVID came, we began to do a lot of lab work.
Oh, okay.
And we've done a lot of connections to various laboratories, regional large labs around the country, primarily focused on sending out orders, receiving results, that type of connection, which is heavy lift because it also is that last mile connection that our competitors do not do. As we've moved away from COVID, we're really starting to pick up a lot of digital health companies, and those digital health companies have recognized that there are gaps in the ability of our competitors to deliver that last mile. And I think that's where Innovar steps in and we're able to deliver that.
Yeah, I think it's interesting because in the interoperability space, there has been a lot of investment, new entrants, some old guard too that's continuing to consolidate and do all sorts of interesting things. So it's interesting that you've been successful amidst all this competition. It's interesting to hear the lab space. I mean, I think there's so many interoperability opportunities in healthcare that's what I think makes it interesting, right? It's almost like, where do you start, right?
Yeah. Well, and there in my view, there are really two types of competitors for us.
Okay.
Right. There's your classic interface engine vendors. Sure. Rhapsody would be a good example of those guys, and that's really not the space we're in. Right? We're not in the business of selling a software development platform. We're more in the business of delivering a service, right? That last mile connection, and then the other side of that is the network providers. So if you go look at TEFCA and you look at the latest applicants for QHINs, you're going to find a couple of our competitors.
Right.
The thing with those folks and our difference there is in our ability to do that last mile connection. Their focus and area, from my perspective, is particularly in the network. And for us, that's, I don't want to say easy, but it's not a heavy lift for us. That heavy lift is down to that field level detail. I need to exchange demographics, right? Or I need a custom formatted output file. I need to convert my legacy HL7, and I need to convert that to, say, some other type of format.
Okay.
Or I need to go from a Salesforce API to a legacy EHR system and doing that conversion. That's where the heavy lift is. And I think that's where we're really good, because our focus is moving data from any source to any destination in any format. And we've done a number of those, countless at this point.
Sure.
And it's
always growing.
And always growing.
Doing new systems, right? Well, I think it's interesting too. You mentioned that you're not this platform that they can just, they have to code themselves and do all that, right? Which is what the integration engine space was. And works fine for some people that have the skilled base. But I think it's interesting that you're applying a managed service model,
yes,
which we know in IT, right? In security, in IT infrastructure, we see the managed service model all the time. Talk about that value of managed service when it comes to interoperability.
Well, our company, we want to be easy to work with. We want to use simple to understand pricing. We want to have white glove treatment of our customers. We will take your interfaces and your integration needs, and we will own that for you as a complete managed service. It's a turnkey implementation. We have a simple, easy to understand pricing model. We're easy to engage with, frictionless engagement. We want to take the burden off of you, and we want to allow you to focus on what your core business is. For example, digital health, they're writing their application and their software, right?
Sure.
You can go focus on that, and we can do the interfaces and the integrations for you in a turnkey approach. And it's a managed service with easy to engage with. A number of our customers talk about that a lot. It's so easy to work with you. It's so easy to engage with you. And that's exactly what we want to do.
That's interesting. You're right. The digital health companies just want the data. They don't want to become interface engines.
And it's all about focus for us. And our expertise, our deep skill set is in this area. And that's all that we do. We have products and services that wrap around that concept, but our focus and area is in integration. So if these companies that need to spend their time in their application, that's great. And we can work with you and run in parallel with you, work with your development teams, run in parallel to do these integrations for you. Let us do what our specialty is, which is interfaces, and you focus on your application or your patient care or whatever other area that you're in.
So talk about some of the big pain points you're hearing from your clients and how you're helping to solve them. Obviously, the big pain point is getting the data, right? That's the biggest goal. Like, give me the data, right? What are some of the other things? Is it the number of connections? Is it, what are some of the pain points that you help them solve?
What we're seeing is difficulty in connecting with these EHR vendors. And these, I'm saying
there's 300 or something.
Yeah, there's 300, but there are a number of those. But we've worked with all of the big EHR vendors, and it's not frictionless. It's difficult to engage with them. It can be difficult, not all of them, but it can be difficult to engage with them. And there are steps that need to be followed to ease that along. We've done it. It's a turnkey approach for us. So we'll make the calls to these vendors.
You have the relationships already.
We have the relationships. We know the people to call. We know the phone numbers to call. We know that who needs to get these emails, and how to move that along quickly. Typically our first engagement if we have a new EHR vendor and they're not in our library, then we'll work with them, and we see tremendous efficiencies after we've done one or two or three. Example, we had one vendor that was a pediatric EHR vendor, and the first interface we did with them, it took us about 8 weeks.
Okay.
Right. We did the second interface with the same vendor 2 days. Took us 2 days. Because we knew the people to call.
You had the libraries.
We had the library.
We
just duplicated what we had already done, rolled that into our network, and we were able to communicate quickly.
That's impressive. And I guess the 2 days is probably understanding what the client wants from the EHR.
Yeah, well, and it was a specialty practice, pediatrics, and this was a second specialty practice. So we were familiar with the terminology. We were familiar with the lingo. We had done one already, recently done one, and we're able to speed it along really quickly. And the vendor was familiar with us. We worked with him quickly, and we do that a lot. We typically we engage with these EHR vendors, but they're big companies, but we often see the same people.
Sure.
All right, so we'll reach out to the same person over and over again, and that helps with efficiency.
Yeah. Well, and that's valuable to your clients. That's amazing.
Yeah.
So what do you see on like the next 2-year roadmap? You know, how are you looking to better serve clients?
Well, you know, our view on the interface, and our view is that an interface is a custom software module.
Okay.
And it's today it's a component, and there are platforms that you use to develop that. But you know, the industry has long since abandoned the idea of making custom software. The make versus buy debate is 20 years decided, but yet we continue to make interfaces, and I'm not clear.
That's interesting.
Yeah, it is.
Yeah.
So what we're going to do is we're going to devolve those interfaces into logical functions, and then we're going to create microservices from those functions. And that's what we're doing over the next couple of years, is we will create a series of microservices that will make it easier for folks to communicate and to integrate, for our customers to communicate and to integrate. And it will provide us tools and methodologies to move down that path more efficiently.
That's awesome. Well, Loyd, it's been fascinating to learn more about how you approach integration and interoperability, a problem that every company that reads healthcare IT today is dealing with and trying to understand how to navigate. So appreciate you taking time to share those insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Loyd.
Thank you.